Well, hello, good afternoon. Thank you so much for joining us today in my home county, Tampa Bay area. I am proud to be with you and standing with so many people here that are passionate about recovery from drug addiction on National Fentanyl Prevention and Awareness Day. This is recognized every year on August the 21st. The DEA um, has launched programs to make sure we're recognizing those people that we have lost in our country to fentanyl and the epidemic. We also want to make sure we're getting the word out, that people understand that fentanyl and overdose in general is still the number one cause of death in working age Americans, 18 to 45. This is the number one challenge we face as a nation right now. And it's incredibly important on this day and really every day that we remind folks that the drug fentanyl is killing tens of thousands of Americans every year. And oftentimes, the people that are dying from fentanyl overdose don't even know they're taking it. It's being laced into counterfeit pills at the rate of 5 out of 10 currently. At the height, it was 7 out of 10 counterfeit pills had a lethal dose of fentanyl. So to put that in perspective, if your kid takes a pill from a friend and it's a counterfeit pill and they think it's Adderall or Xanax, right now there's a 50% chance there could be a lethal dose of fentanyl in that pill. That is why the fastest growing age demographic for fentanyl overdose is 14 and under. And so today it's incredibly important that across our state and certainly the entire nation, that we come together and talk as a community of parents. We talk with our children. I still have a child in school and warn them of the dangers of fentanyl. I cannot tell you how many parents I have sat with, cried with, tried to raise awareness about this issue so that children understood when they were going to friends or smoking an illicit vape. There are so many things fentanyl can be laced into now. And we want to make sure people are cognizant that it's out there, that lethal fentanyl still is the number one challenge to our health. It is the number one driver of death among Americans. And we want to make sure that they know it's being laced in every kind of drug, illicit substance. So if you do have a substance abuse problem, it could be more important now than ever to get help. Today, I am at a great recovery center, addiction and recovery. There are numerous facilities like this across our state, across our nation. If you are struggling, you can go to treatmentatlas.org or findhelp.gov to find a location to get help near you. Many of those tools allow you to put your location, your insurance information, your payment information, and it connects you with a resource to get treatment. Here in Florida, we have been very focused on this, both in my time prior to being Attorney General as a federal prosecutor and judge, dealing with families that were facing this issue. And then as Attorney General, we recovered billions of dollars for the state of Florida to put towards abatement of this issue. I want to commend Attorney General Pam Bondi, now U.S. Attorney General Pam Bondi, for standing right here in this facility and launching the case that went after opioid manufacturers, distributors, pharmaceutical companies to seek redress for what began as an opioid pill epidemic and has morphed into the challenges we now see from fentanyl and related synthetic opioid substances. As you know, we just passed and the president signed the Halt Fentanyl Act, which scheduled the fentanyl-related substances. These are fentanyl analogs, where these illicit chemists from the substances generated in China and then coming into Mexico and into our country, they would change one compound to try and get around our laws. And we just passed that to make it easier to put those poison peddlers and traffickers behind bars. But that is only one piece of the way we solve this issue. We also make sure our first responders are equipped to save lives, to give people a chance at recovery. And then we make sure they're connected with places like this and places all around our country that can help them recover from addiction and go on to lead productive lives, not just for themselves, but for the families and those that love them and depend on them. So, as Florida's former Attorney General and as your newest United States Senator, I want to use today to again raise awareness, make sure that we are talking as a community and certainly within our own families internally about these dangers and how to get help. And I appreciate you guys being here today on this day, National Fentanyl Awareness and Prevention Day, to help us spread that word. And I would love to give this opportunity to Dr. Michael Soria to make a few comments. He's the medical director here.
Well, I'm just going to be very, very brief. Usually takes me 10 minutes to answer a yes or no question, but I will be extremely brief. On this day, it is important to recognize that we've lost, over 100,000 people a year to the fentanyl crisis. To put fentanyl in perspective, it is so ubiquitous now that even people that think that they're buying a Vicodin or an oxycodone or heroin, they really aren't. They're basically getting fentanyl. We see that all the time in the testing that we do here. The problem with it is it takes a tiny amount to be lethal, especially in opiate naive people. So as the senator mentioned, a 14-year-old that thinks they're buying a Vicodin and takes it, if it's fentanyl, it's likely going to kill them. The amount of fentanyl that it takes to kill someone is the equivalent of 5 to 7 grains of salt. So imagine taking a salt shaker, dumping a little in your hand, count out 5 pieces, tiny. And the folks that make these drugs, they don't really pay attention to how much they're putting in. So bottom line is it's still a problem. It is getting a little bit better in our state, but it is still a significant problem. If you have a loved one or if you yourself have a problem, then get some treatment. Call us. We can help find you the right place to go. There are other government agencies that you can contact, but the key is making that phone call to get help, and then we or whoever you go to treatment with can help you get on a road to recovery. Thank you.
Thank you so much again. If you are a parent or a loved one of a family member that is having substance abuse issues, please encourage them to get help. Again, that's findhelp.gov. You can also go to treatmentatlas.org or 1-800-662-HELP.